This is Xiehe Dongxihu Hospital. It was one of more than 60 hospitals in Wuhan designated for treatment of COVID-19 patients. And this area was renovated into an isolation zone for the treatment of infected patients. It's now been cleared as the pandemic has largely been kept under control and improved in Wuhan. As you can see behind me, these temporary walls are still here. They were used to separate clean and buffer zones from the contaminated ones. And the entire renovation was completed within 2 days and was not too difficult to get done. But let's think about the efforts needed to transform ordinary wards into the ones that reach the standards of infection control within 2 days. It could be mission impossible. The hospital did it, but how?
我们当时的话接到这个通知是1月21号。
We received the renovation order on January 21st. As required, we needed to turn the area into isolation wards. But what we already had at that time didn't qualify, so we needed the support of infection control experts. We invited some experts from Jinyintan Hospital who helped design the isolation area, and then we conducted the renovation based on the design. When the renovation was done, we realized that we were lacking medical devices and medics. Since we needed specialized areas for treating respiratory and infectious diseases, we had to buy many more medical devices, like ventilators. All medical devices we needed were sold out in Hubei province at that time. Therefore, we had to contact companies outside the province. Besides, all our physicians and some surgeons had been arranged to treat the virus. I was doing everything I could to help. I even used doctors specializing in traditional Chinese medicine and operating room nurses to help with work in isolation areas.
By the end of the day, on March 12th, the hospital has treated over 1,200 patients, among which 554 people were discharged from the hospital. 187 patients in critical condition were transferred to hospitals with better ICU units for treatment. And 348 patients' symptoms had improved, and they were sent to local clinics. That has helped release the burden of the hospital and saved a lot of hospital beds for those in need. What I'm trying to say is that all designated hospitals in Wuhan have different treatment plans for patients under different health conditions, thanks to a very special hierarchical medical system.
最开始那段时间，就是说，这个病人的话住不上院。
At the beginning of the outbreak, there were not enough hospital beds for some infected patients. The isolation areas were fully occupied. Then we started to analyze and realized that some of the patients only had mild symptoms. Those mild cases could have been well treated at local clinics. As a result, we took over 3 local clinics. We transferred all mild cases to the clinics. So we managed to save a lot more hospital beds for patients in critical condition. Then severe cases stayed here. Those in critical condition were then transferred to hospitals where assisting national medical teams were staying. By doing so, infected patients with different health conditions can be treated in the most appropriate and effective ways.
Another key element for the provisional victory over the virus in China was the support of assisting medical teams from across the country. China's best respiratory, infection, and ICU medics were sent to Hubei province to help. That made the treatment capabilities of Hubei province significantly greater.
They have been a magnificent help to us. Only the Chinese government can manage to do it. They were on call at any hour. The medical team who assisted us received the order on Chinese Lunar New Year's Eve and set off to help us the next day. 50 of them were then dispatched to Jinyintan Hospital. The remaining over 80 medical professionals took over 2 of our isolation areas and started to work as soon as they adapted to the new working environment and received some training.
This school dormitory has been renovated into an isolation area, which has been quite multifunctional. At the very beginning of the outbreak, it received suspected cases and their close contacts. Later, patients who had recovered from severe symptoms but needed rehabilitation care were sent here. Now it takes in the close contacts of all the symptom-free coronavirus carriers. It helps release the burden on designated hospitals and put all those suspected cases and their close contacts under observation and control in order to cut the source of the infection. It has been quite helpful and very important to the medical system hierarchy.
我们每天基本上都是一个医生一个护士2人为一组。
Every day, we would send one doctor and one nurse as a group to the isolation facility to check on patients' health conditions, including their body temperatures, pulses, breath, blood pressure, and see if they remained within a normal range. We needed to check to see if they had a fever, lacked energy, coughed, had chest pain, and so on. We needed to specifically ask about their psychological needs. If they got anxious, agitated, or nervous, we'd help them if we could, or we turned to our psychologists.
在我们东西湖区的话，大大小小的，当时的话也有32个隔离点。
There were 32 isolation facilities in Dongxihu district at that time. We took over the largest one. It had been playing an important role in pandemic prevention. Hospitals, of course, were there for treatment, but patients who needed rehabilitation care were sent to the facility.